Welcome to Dr. Martin, Head and Neck Radiology. In today's video, we will review the radiologic findings of the antrochoanal polyp, a benign but clinically significant entity that every radiologist and trainee should be able to recognize. The information presented is based on established radiologic literature and illustrated with a representative clinical case. The case involves a 9-year-old child with left-sided nasal obstruction. A non-contrast CT scan of the paranasal sinuses in the bone window demonstrated a mucus density lesion occupying the left maxillary sinus, with extension through the osteomedial region toward the posterior nasal cavity, the choana, and into the nasopharynx. There was smooth expansion of the drainage pathway without evidence of bone destruction. MRI of the paranasal sinuses showed a lesion that was hyperintense on T2 weighted images and hypointense on T1 weighted images. After intravenous contrast administration, the lesion demonstrated peripheral enhancement without central enhancement, consistent with its cystic and mucus content. The lesion extended into the posterior nasal cavity and choana through an accessory drainage ostium. An antrochoanal polyp is defined as a solitary sinonasal polyp arising from a maxillary sinus and extending into the nasal cavity through the natural maxillary ostium or an accessory ostium. In some cases, it may reach the nasopharynx. This entity is also known as Killian's polyp. Other solitary polyps are named according to their site of origin and termination, such as sphenoconal, nasochoanal, frontoconal, and ethmoidoconal polyps. However, the antrochoanal polyp remains the most frequently encountered among these variants. CT is the imaging modality of choice for evaluating antrochoanal polyps due to its excellent demonstration of anatomical detail and bony remodeling. Typical CT findings include a hypodense mucus lesion originating in the maxillary sinus, which may show increased central density if chronic or associated with fungal infection. Extension into the nasal cavity is observed through the primary or an accessory ostium. When large, the lesion may reach the choana or nasopharynx. Widening of the ostium with smooth remodeling, but without bone destruction, is characteristic. MRI provides complementary information regarding lesion composition. On T1 weighted images, the antrochoanal polyp typically shows low signal intensity, although chronic lesions may demonstrate variable signal. On T2 weighted images, signal intensity is usually high, approaching that of free fluid. After contrast administration, peripheral enhancement is typical, with absent or minimal enhancement in the central portion. Before proceeding, I invite you to watch another educational video on this channel discussing the radiologic findings of a frontal mucocele on CT. You will find the link conveniently placed in the comments section of this video. The differential diagnosis of a mass extending from the paranasal sinuses to the posterior nasal cavity includes intranasal glioma, nasoethmoidal encephalocele, juvenile nasoangiofibroma, inverted papilloma, esthesia neuroblastoma, and sinonasal mucocele. Distinguishing features on CT and MRI, combined with clinical context, typically allow an accurate diagnosis. Pathologically, antrochoanal polyps result from edematous hypertrophy of the respiratory mucosa. Although the exact etiopathogenesis remains unclear, these polyps are often associated with chronic inflammatory sinonasal disease, including chronic rhinosinusitis and allergic rhinitis. Post-obstructive inflammation within the maxillary sinus is frequently present. Clinically, antrochoanal polyps are more common in adolescents and young adults, though they may occur in children, as illustrated in this case. The most frequent presenting symptom is unilateral nasal obstruction. Surgical removal is generally required, with endoscopic sinus surgery being the standard approach. Thank you for watching this educational review on antrochoanal polyps. If you found this video helpful, please subscribe to Dr. Martin, Head and Neck Radiology, give the video a like, and leave a comment. Your engagement helps support the creation of more high-quality radiology content for learners and healthcare professionals around the world.